Welcome to Med in 5. The goal of our channel is to help you understand medical concepts in a flash. This video is part of a series explaining bacterial infections. Today, we're discussing Staphylococci. Before we start, think about the following. Which staph species is coagulase-positive? Which one forms biofilms on prosthetics? Which one causes UTIs in young women? Stay tuned for the answers. All Staphylococci are non-motile, gram-positive bacteria that form clusters and are catalase-positive, meaning they bubble when exposed to hydrogen peroxide. These round bacteria usually reside in the skin, nasal passages, and mucous membranes. While they're part of normal human flora, they can become pathogenic, especially in vulnerable people. We'll start with the most notorious, Staph, Aureus. It's coagulase-positive, distinguishing it from other Staphylococcus species. Staph aureus is also beta-hemolytic, meaning it breaks down red blood cells, creating clear zones around colonies on blood agar. It forms golden yellow colonies when cultured, hence the name Aureus, meaning gold. Staph aureus is equipped with potent toxins, including toxic shock syndrome toxin, or TSST1, exfoliative toxin which causes scalded skin syndrome, and various enterotoxins responsible for food poisoning. Staph aureus also makes protein A, which inhibits the immune system by binding to antibodies. By doing so, it prevents opsonization, where antibodies mark microbes for destruction, and phagocytosis, the process where immune cells engulf pathogens. Staph aureus causes various infections, including cellulitis, which makes the skin red and swollen, abscesses, which are painful pus-filled lesions, and more serious conditions like osteomyelitis, a bone infection, and endocarditis, which affects the heart valves. Staph aureus can also cause pneumonia, a lung infection marked by cough, fever, and chest pain. The toxins made by this organism can cause toxic shock syndrome, producing fever, rash, and organ failure. Scalded skin syndrome, where the skin peels, occurring mostly in infants, and food poisoning, which causes nausea, vomiting, and diarrhea lasting 1 to 2 days. Diabetes mellitus, surgical procedures, IV drug use, and immunocompromised states as an HIV infection or chemotherapy increase the risk of Staph aureus infection. For antibiotic therapy, methicillin-sensitive Staph aureus, or MRSA, may be treated with beta-lactams like nafcillin or oxacillin, which kill bacteria by binding to penicillin-binding proteins and blocking cell wall synthesis. In methicillin-resistant Staph aureus or MRSA, the MEK-A gene alters penicillin-binding proteins, making beta-lactams ineffective. So, alternatives like vancomycin and daptomycin are used. Vancomycin binds to cell wall building blocks to prevent their assembly, while daptomycin inserts into the bacterial membrane, causing cell leakage and death. Next, we have Staph epidermidis, a coagulase-negative species often linked to biofilm formation. This ability to form biofilms on prosthetic devices, catheters, and heart valves makes Staph epidermidis a leading cause of device-related infections. On blood agar, it produces white colonies and is gamma-hemolytic, meaning it doesn't cause hemolysis. The virulence of Staph epidermidis is largely attributed to its biofilm formation, which protects it from the host's immune system and antibiotics. It's most commonly found in hospital settings, where patients with implanted devices are at high risk for infection. Common diseases include endocarditis, especially in patients with prosthetic heart valves, and catheter-related bloodstream infections. Staph epidermidis is often methicillin-resistant, so vancomycin therapy is necessary. Empiric antibiotic coverage, when clinicians start treatment before knowing the exact cause, often includes vancomycin, particularly in hospital-acquired infections. Now, we have Staph saprophyticus, another coagulase-negative species, but with a distinct role in urinary tract infections or UTIs, particularly in sexually active young women. It's urease-positive, increasing the urinary tract pH so it can thrive. On agar, Staph saprophyticus forms white colonies and is gamma hemolytic like Staph epidermidis. Staph saprophyticus can cause UTIs, but is often novabiocin resistant, as opposed to Staph epidermidis. Treatment usually involves nitrofurantoin or cotrimoxazole, as Staph saprophyticus is usually susceptible to these agents. Let's review our questions. Which Staph species is coagulase-positive? Answer: Staph aureus. Which one forms biofilms on prosthetics? Answer: Staph epidermidis. Which one causes UTIs in young women? Answer: Staph saprophyticus. Did you get all the answers right? Good. If this video helped you understand Staphylococci better, hit like, share, and subscribe. Click the link below to access the table summarizing the differences in their micro-test results. Check out our next video on the Streptococcus species. Thanks for watching.